The Hispanic and Latino community is accounting for more than 30% of coronavirus cases statewide, and that has some people questioning why.
We had phone calls from families that thought this was a hoax back in March. A lot of families didn't really believe the severity of the virus.
The Idaho Commission on Hispanic Affairs believes this is just one of the reasons why the percentage of cases within the Hispanic and Latino community is so high. Another is because most of these families are uninsured.
Some of it has to do with the testing. If we already had a concern about the percentage of families that were uninsured before the pandemic. And since the pandemic, if an individual goes in to get tested, there's a cost involved with the testing.
A cost that most of these families cannot afford, especially since they would have to get every single family member tested.
We have multiple families that live in one household. We come from historically we have large families. And when you have multiple families that live in one household that are all sharing the same bathroom and the same shower, and it's one person comes and can easily infect families, not just one family.
They also tell us the state was not breaking down cases by ethnicity in the beginning of the pandemic, something they had urged the state to do, which also makes it hard to know if those numbers were already high.
At the beginning, Stephanie, I don't quite know that we were not. When I say we, I mean the state of Idaho was collecting data on the Hispanic population, so the demographics piece was missing as far as the breakdown. So health districts and maybe the state lab and others were not necessarily breaking it down by ethnicity.
And they say within the past 2 weeks, they have seen an increase in the amount of organizations reaching out to them with questions about how they can support the Hispanic and Latino community during this time. In Twin Falls, I'm Stephanie Garbe, Idaho News 6.